And this is recording.
It's going to be. It is.
There we go. We are now.
All right. All right. Well, thank you all for showing up. Unfortunately, you can't see my video, but that's okay. My name is Chris. I am the director of education for Digitsole. So I just wanted to take this opportunity to thank you all for attending. I know some people are going to be watching this after the fact because it is going to be recorded, and anyone that has registered for the event will automatically be sent a link to view this recording. And so I am also here today. It is my honor and pleasure to introduce Brandon Noble, who is our Chief Marketing Officer, Head of Sales and Marketing globally. And we're looking forward to some wonderful information on the Digitsole product. So I'm going to hand it over to Brandon.
Thank you, Chris, for the kind intro. And Robin, I invited you to participate. I know I've spoken with the North Coast team, and I believe you've got some questions from that. Obviously, Chris is our education director and also a very practice clinician himself. So, Robin, if it's okay with you, what I'd like to do is maybe just hear a little bit on the data front from you of what questions you might have, and let's just start that way. Robin, can you hear us?
Yes. Can you hear me?
We can.
We can.
Awesome. So I guess we were afforded the opportunity to have the unit in the clinic, and we did try it, test it, and it's very easy to use. But our questions are on the interpretation of the data.
Okay. Do you have something specific that you would like like have you taken an analysis and kind of want to walk through one of them? What's your preference, Robin?
Yeah, I think that would be great. Just what
do you see on the bottom of your screen a little button that says share? It's a little box with an arrow pointing up.
Yes.
Let's see if you can click on that, and if you're able to actually go to the Digitsole interface and just maybe pull up one of those patients, and Chris and I will happily walk through it with you.
Yep.
Oh, goodness. I'm not sure where I go from here. Share screen?
Mm-hmm. Share screen. That's correct.
Share screen. Okay. Let me get out of this.
All right. We're seeing something now.
Yeah, I don't know what I'm seeing.
Yeah, that's okay. We're just seeing multiple. So if you want to, on the tab, open a tab on the top, go into Digitsole Pro. There you go. And then we'll be able to see the information from there. So if you want to just visit DigisolePro.com.
I'm not sure where I'm going from here.
Yeah, just go to DigisolePro.com.
All right. All right.
And for some reason, your screen is still showing like you're on the search engine.
I think I am still. Is that where I'm supposed to be?
So, Robin, we only see like your
screen froze.
Yeah, your screen might have froze. So maybe stop sharing and reshare.
Yeah.
All right, now y'all know you're like a little bit above my.
That's okay.
That's all right. Take your time.
To the share button, and there should be something that says "Stop Sharing." Do you see?
Yeah, it's usually right down on the lower, right above that menu bar where that was.
Disable screen sharing.
There you go. And then go back to share again and click share screen.
I don't know why we're getting all those copies.
Yep.
There you go.
Go ahead and click on the tab up
on the
top.
Digitsolepro.com.
I'm sorry, say that again?
Yeah, click on that. There you go. And then click on that right there. You got it. And then on the top right, we see where it says log in.
Uh-huh.
Click on that, and then just put in your username and password.
I'm not sure I did a username and password. We just used Jeff's.
Just
you want me to make one up?
No, you would need to access Jeff's. That's okay. If you just use Jeff's, no worries. Here's what I'll do. Didn't realize that. I can open mine, and
Okay.
what I will do is we can just look at another one and just walk through the data. So maybe that's the best way to do this. So give me just a second. And you can stop sharing your screen. I'm just going to share mine, and then we will be able to look at some. Now, were you looking at a walk specifically, a run, the jumping
Stop share.
analysis?
Hang on, I'm trying to stop sharing. Disable. Okay. Okay, are you still there?
I am.
Yep, still here.
Okay.
Still here. So I'm going to just share my screen real briefly.
Okay.
Screen. Just a quick second. Oh, there we go. Share. Okay, can you see my screen?
Hello, Brandon.
You got me. So was it a walk analysis or a run analysis or a
Walk analysis?
Walk. Okay, great. I've got a good walk here, which is my personal one. So we'll just look at details of mine. So I'm going to just kind of walk through here. Tell me, specific. Oh, and let me just change my filter. There we go. Okay. Anything specific you want to review or cover on the data, or do you want us to just walk through it?
Let's just walk through it
So
because.
Chris, I'll let you take this.
All right.
Okay, hang on. I am saving my documentation and I'm getting out of that. So now you have my undivided attention.
Great.
Nice. Okay. So one of the things you notice is it has your complete list of patients, and then when you click on a patient, it pulls up all the analyses that you've done.
Mm-hmm.
And if you ever need to go back to that, you can just click on dashboard, or practitioner analysis will list basically all of them. And you can actually rename these. So if you wanted to call it something different, like if there was a change, you were wearing a different pair of shoes, you had them using a walker, whatever the case may be, you can kind of label those things and make it a unique name. Obviously, it's date and time stamped. But so when you click on that, it'll pull up the specific output. So you can see across the top where it says what it was, which was a walk,
Mm-hmm.
and then going down a little bit further, we'll come back to the details in general. You'll see that there's a summary, and also you see there's panes, walking aids, and shoes. That's some of that data you can input while you're collecting the data during the patient process, or you can put it in now. You don't have to. It's completely up to you. Sometimes it's beneficial, like I said, if people are trying out different shoes or something like that. I typically tell patients, we wear the same shoes every time. I just put a quick note either in shoes, or you'll see when we scroll all the way down to the bottom, there's also a place for comments that you can also put in when you export the file. So you see across the top of this dashboard, symmetry, cadence, and speed, and you'll notice that they're colored. So there's 3 colorations. And this is part of the artificial intelligence aspect of it. So what we mean by that is it not only collects data, it aggregates it or runs some computational mathematics to actually post it against some of the normative data that is in the literature. That's why it's important that you input the appropriate patient demographics, because this is going to be based on age, height, weight,
Okay.
gender, and shoe size. So all of those questions matter. Okay. And so we look across the top, and these are kind of the more basic ones, but they're pretty important because we know as human beings we're somewhat symmetrical, and so that symmetry characteristic is for ground contact time during the walking profile. So that's going to be called the stance phase. And it says 99. So they're 99% symmetrical in terms of the amount of time that they're spending in contact with the ground. So it's in green. So green means that it's within the normative values. And then if it shows that it's in amber, sort of that orange color, that means they're one standard deviation away from that. So typically that's going to also be on the far end of normative or mean values. And red is more than one standard deviation. And so we see that green in symmetry, green in cadence, and amber in the speed. So I look at symmetry always first because we're supposed to be somewhat symmetrical from right to left. And what you'll see is as soon as that hits 95, it's going to turn amber. And so that's how that's going to work. It shows green, so I don't spend a lot of extra time looking at that. Cadence is going
So
to be relative to their speed and their height. So that's going to be the number of steps per minute. And then we see speed is at 2.7. And so it shows that they're kind of just outside what's considered to be the normative value for speed. So there's a couple ways that you can do this. Sometimes I use a treadmill, like if I really want to control the speed as a specific variable, because sometimes I'll use sort of what's called a stress load test. How are they walking at 2.0 miles per hour? They could be perfectly normal, put them up to 2.5, and that's when all heck breaks loose and we can start to identify some of these issues. The other option is self-selected speed. So that's where we tell the patient, listen, I want you to walk at a comfortable pace, but with intent, as though you needed to get someplace without being late, right? And so the reason that that's important is it's a really simple but powerful test, especially as we get into middle to older age adults, of morbidity and mortality. And that's why, like, for me, this hits home with people because walking is supposed to be something really simple, basic, that we're all familiar with. And actually, they're supposed to be able to accomplish at a specific speed. So just knowing that they're lower than that, and what we find is this 2.7, they're on the low end. And the problem will be is if they started to walk even slower, once you hit below 2.4, you're actually looking at a real difference in morbidity and mortality. So, obviously I don't say that to patients, but I say that's a problem that we want to make sure that we address. And then, so let's say we look at the walking profile, and the colorations here just to signify left versus right. So left is on the top, right is on the bottom. And that 50.5 inches is going to be the stride length that we see on that left. And then we compare that to the right and we see 54.1. So this is of interest to me because symmetry showed that they were basically symmetrical, 99%, but yet, they've got a significant, more than 3-inch difference in stride length between the right and the left. So basically that says, so if they were in ground contact time the same amount of time, they must be making up for that someplace. And so basically, to have a longer stride length but have the same ground contact time, it means that they're moving through that swing phase faster. So then the question arises, is it the right or the left that's the problem? Are they going too far on the right, or is it not enough on the left? So the way that we answer that question is we're going to click on, if we go up a little bit higher, and see where it says standard and advanced, we're going to click on the advanced. And this is actually going to give us much more detail to this walking profile. This is, again, even when people are like, I don't know if, what's their stride length supposed to be? The cool thing is you don't have to know. You can look at this, and this is where, again, the artificial intelligence comes into play and that coloration. So we see the stride duration. So they're pretty close in time, but that right foot is actually showing that the stride duration is a little bit short. And here's what's interesting. The reason that we're able to accomplish 99% symmetry is the neurological system is a pretty cool and powerful thing. And it needs to try and, sort of match these two things up. Otherwise, he would probably keep turning to the left if it wasn't working out right. So we further dive into this and we see that the stride length is a little bit short, actually, on both sides. So even though that one was longer, it's telling us that they needed to really have a longer stride length on both of these. So that's certainly something I'm going to take into consideration. And then we look at the swing time, and we see that the swing time is actually really, really short. So it means that they're taking short strides. They're trying to move, fairly rapidly, and they're going through that swing phase, and they're compensating for, their stance time, which even then is a little bit low, but they're moving through the swing phase really fast. Okay. And that's why their cadence is actually showing that it's normal, even though that their speed is a little bit slow. So we could spend even more time in looking at that, but that's kind of how you read that, looking at the coloration. But the cool thing is, it not only tells us that, the difference between the two, but it tells us if it's too much, too little, or just about right, which is going to be the green. So then we scroll down to the next marker here, and we look at the gate line. So the gate line is looking at the trajectory of the center of pressure through that stance phase, right? So it's kind of telling us, are they putting the pressure through the foot at the different moments in time that they're in contact in the right position? And so we see that they look pretty good in terms of the amount of time or the relative percentages that they're in each one of those. In other words, the loading phase percentage is normal, the foot flat position is normal, and then the propulsion is going to be normal in terms of the amount of time that they're spending. If we want to click on the absolute, it actually gives you that value in milliseconds, which for a lot of people that may not even make a whole lot of sense, because it's more the percentages, and it's showing us that they're fairly normal. That trajectory is within probably that normal deviation. Sometimes we would see people would heel strike, especially on one line further on the outside, right? Because that's going to indicate that they are with heel inversion or a supinated foot when they heel strike. And then, of course, that reduces when they go into that foot flat position. And then we get ready for propulsion or toe off, and that's going to force us, over to that first and second ray. So that trajectory pattern, it looks really symmetrical, and it looks fairly normal. And then the propulsion rate. So the propulsion rate is the ratio between the hip flexors and the plantar flexors, or the toe off, the propulsion of the foot as they're moving into swing phase. So that's actually going to be calculated through, how fast they're moving into that position. And so there should be this ratio calculation that says it's a coordinated effort between the foot and the hip flexors. So what we see here is the left looks pretty normal in terms of that ratio. The right, it's showing us that he seems to have a strategy of not using as much hip flexor, and he's using more of that plantar flexion. And if you remember back to when I said, well, how could they be symmetrical in terms of the stance phase, but yet have a longer stride on that side? And it's because he's pushing off really fast with that foot. So that's telling us that, he's trying to compensate for something. Whether we know exactly what that is at this moment, we may not really be sure. That's why, again, the patient history is also going to be important. But it does tell us that he's over engaging plantar flexion and under engaging hip flexion. Okay. Now, if we go back all the way to the top, we can click on details. And details is going to give us another page to look at, and it's a little bit more deeply involved in terms of some of this data. So the pronation supination angles, this is the orientation of the foot sort of in that frontal plane, pronation supination or heel inversion eversion. So it gives us a specific angulation. And again, it's going to give us the coloration. So if we look at all the way over to the left on heel strike, also known as attack, we've got negative 14 degrees and negative 21 degrees. So that negative angle indicates that that's an inversion or a pronation position. A positive angle would indicate that it's, the supinated position or inversion. Pronation or eversion is going to be that positive angle. So we actually have a different view of this, which I think makes it a little bit easier to look at. So if we click on the advanced right next to where it says standard, it gives us this graphical representation. So these are numbers specifically developed by our system. And you see that green shaded area, that's actually considered to be the normal trajectory of the foot. You'll notice that it's always to the outside. So on the right, it's going to be to the right of 0. On the left, it's going to be to the left. So we're using this mirror image. And so it's always going to be sort of a negative angle. And we see that overall, all the way over on the right, he really does approach and gets over into that pronated position. So that really means he is over pronating as he's going into that toe off position and likely missing out on an opportunity for forefoot supination. And you can put your cursor over each one of those dots and it will give you that actual number. You'll also see that there's 2 numbers on either side. And those 2 numbers on either side, that's going to be the standard deviation. So we know that there should be some degree of variability and they should be parallel. And if they're parallel, it means that we're very consistent. And you can see that using, again, that green corridor, that green shaded area, that gives you a good sense of what the middle would look like and then what a standard deviation would be. So we're seeing some wider standard deviations, especially on the left. And then it sort of does that open up funnel when it comes to toe off. So that tells us there's a much greater degree of variability, especially in that propulsion on that side. And we see that it's not exactly consistently parallel and it's pretty wide even on the attack. And then we see over on the right side, it's a little bit more consistent. When it's really consistent like that, it means that someone's doing that repeatedly over and over again. It's either because that's their normal or that's something chronic that they've worked really hard at to basically to facilitate. So we look at that right side and at least the pattern looks pretty normal. And so next questions would be, do I need to test them in a different pair of shoes? Do I want to try an insert or something like that? And maybe see if that's going to change things. But we definitely see on that other side that he's got a lot of variability on that left side. So certainly something to take into consideration. And then we can go down one step further and we see foot progression angle. And so the foot progression angle is the degree of toeing out position. Within plus or minus 2 standard deviations basically gives us about -2 degrees to approximately 14 degrees, 13.5 degrees. So normal toe out position, if someone was to just be standing there, it's usually 8 to 10 degrees of external rotation is sort of that average. So what we see here is 6.2 degrees, certainly within the normal on the left, but on the right, we're at 16. So it's looking like there's a little bit too much external rotation going on. So sometimes that can be a strategy that people will use if they can't really dorsiflex at the ankle, flex at the knee, or they have excessive external rotation at the hip, or like I said, that's their strategy. But least of which, it's very asymmetrical, right? We're looking at a 10-degree difference between the right and the left. And so I would want to, further look at that and say, is it a problem? And which side is it? Again, it could be a strategy because of an ankle or a knee problem, potentially a hip problem, or, it's got really tight external rotators on that side. The other way that we can delve into that a little bit more is you can see up at the top, it shows you 1.4 inches on the right and 0.6 inches on the left. And basically that's the amount of outswing that the leg was moving. So normally, a trajectory of going straight forward, swinging like a pendulum, but we don't do that when we're typically walking. So there usually is going to be a little bit of an outswing. So what I'm seeing here is really, an external rotation. That foot progression angle is really large, and definitely seeing that 1.4 inches is more than twice that. So it looks like he's performing some sort of strategy on that right side to compensate for something. And then we look at the steppage and the clearance. So these are the angles of the foot relative to the ground surface on propulsion, which is also toe off, which is the first one you see on the left. And then in the middle, you see an inch numerical value. So that's actually what's called minimal toe clearance, which is a really good metric if you're looking at like fall risk, for example. And then there's going to be the heel strike position. So pretty symmetrical, between the right and the left on propulsion, as well as heel strike, as well as the minimal toe clearance. So it's in green as well. So we don't really see any issues right there. So there's potentially a little bit going on both of these sides, and that's why again, the history is important, because maybe some of the deviations on one side could be because of the problem that we see on the other side.
So, based on what Chris just went over, is there any questions or?
Well, that's a lot of data.
I kind of apologize for that, and then I also say, that's how much you can get. Is it, how much of it is necessary? Like I said, again, having the background on the patient certainly leads me to, evaluate these a little bit differently. So a lot of times, Robin, people will send me something, they'll give me no background data, and I'll just run through, potentially every conceivable scenario. But having that history, can really help streamline this and sort of help you direct, where your eyes are going to go. So once you've gone through this, you have that history. I normally do this in about 2 minutes.
Wow. So then you can take what you see in that 2 minutes, and you can develop a treatment plan or an exercise program that's going to
Guys,
direct.
I'll add a little bit of clarity. So this is me, and at this point in time, I had a low back strain that was pretty significant from doing squats, and it was predominantly on the right side of my back. So that's a little of the background on this.
Yeah. So go back to this other page, and let me be a little bit more directive, when it comes to that, right? So first off, Robin, we know that when people have an acute injury, variabilities are going to be high, and we're talking about a spine, and that's what's challenging for some people. I mean, you have more pain on one side, but there's a compensatory mechanism that's going to go on. And so basically what's happening is really good symmetry, but that swing phase on that right side, was a little bit further. And maybe that's because he wanted to spend more time on that left side, right? And remember that stride length is obviously going to be sort of a component of both. And then go down a little bit further, Brandon, to the propulsion rate. And so this is really common, Robin, that we see that oftentimes people with low back pain, we also see this in just older adults in general or sedentary populations, is he does not want to engage on that right side and with his hip flexors, because his stabilization component, pulling on that right hip flexor is going to actually create more torque in that lower spine level. So he would rather create the propulsion into the swing phase on that plantar flexors, his calf muscles. So that's commonly seen in patients with low back pain, for example. Chronic patients, I typically see both sides actually see a reduction in engagement of core. And that's kind of, back to the chicken or the egg. Is it lack of core stability that caused their back pain? Or we also know that chronic low back pain also reduces core stability engagement, just because they tend not to want to use that. And then when we look at those pronation and supination, that's why we saw a lot of that variability is real common in people with acute conditions. And so a lot of compensatory changes also going on. And of course, in that foot progression angle, we did see that it's another strategy to reduce torque on that spine by just kind of dangling that through. And because we know that position and that amount of circumduction is like Faber's position, right? Flexion, abduction, external rotation. So it's kind of that open pack position on that hip. So it actually can swing a little bit more like a pendulum, especially when he's pushing off so hard with his plantar flexors, which we saw. And because that's not normal for him, it goes into a longer stride length because it's just he's cranking that thing through. It's swinging through. So this is definitely a strategy of someone who has some acute low back issues.
Anything else, Robin? Any specific questions? I mean, and obviously we just using anything else for Chris.
Right. So how would we, I mean, obviously you guys have been looking at a lot of these things and a lot of data and you can pinpoint it, but if there were like three main things that you would hone in on that we could kind of start our interpretation with, what would you suggest?
Yeah, so across the top, those basic things, are they, he's
So what I'm doing
otherwise.
here, just so you're aware, is I'm going to create a custom filter for you. Okay. So sorry, Chris. So is there anything in here you want me to select?
So I would choose. I like to look at the basics are going to be the walking profile. So I would just click on the walking profile up top. Okay. Right across. Yeah. So that way it chooses all of them. And then I would click on propulsion rate. Right. Mm-hmm. So you might see some changes and we can come back to that, but let's just maybe start with those guys.
Yeah. Sorry, right. For some reason, oh, that's because I didn't name it.
Oh, you got to put a name.
Yeah.
LB6
here. You said, I'm sorry, not separate clearance, but propulsion. This, correct?
Yeah.
So that's the beauty of what you can do here, Robin, is you can create a custom filter, which I have right there.
Because I could see where this could very easily be overwhelming, but if we start with just a few things to look at until we get more comfortable with the data.
Yeah, so we actually have a clinical guide too, Rob, and I think that really helps people kind of narrow this down.
Okay.
And sort of draw your eyes to some of these things that are going to be important. So here's essentially how I would look at this, and I would say, okay, so you're walking slower, and it's slight. So some people may not even notice that, but basically I'll say to a patient, you're walking slower than normal, and they'll say to me, well, I'm in pain. And I would say, no, I get that, but let's put this on paper and let's show some numerical value, because then, I can get you out of pain by, maybe doing some e-stim or whatever, but you may not actually, walk faster as we run through this. And so I want to show the patients that it's not just about pain, but you actually have some neuromechanical strategies going on here that need to be repaired, even if we get you out of pain. And it's a big opportunity for me to show patients that it's not just about pain. And in fact, a lot of people wait forever. They're in pain before they come to see us.
Right.
And statistically speaking, patients don't come in to see us because they're in pain. It's actually because pain has gotten so bad that they can no longer perform certain activities that they value.
Right.
Right.
And by then those changes in their gait pattern have become habit, which is another problem to deal with.
Exactly. Right. And so that's why we divert away from that, because here, we're just talking about this yesterday, and, WebPT posted this, but only 30% of outpatient physical therapy patients actually complete their course of care. That's two problems. One is we've got way too many people walking around, with the #1 disability in the world, and it's never getting better. And then the statistics show that surgery is just as effective as conservative care, because we never get complete resolution. The other side of that too, from a the clinical business perspective is people aren't, completing care, and then they go back and they're in pain again, and they're like, well, I'm not going back to him because this didn't work, right? Because there was too much emphasis. So we looked at the walking profile and we said, well, even if it's as simple as, right, so we looked at speed, we say, okay, so you're walking slow, and they're like, well, yeah, okay. And then we show, the stance time and the swing time. um, they look pretty similar, but they're actually reduced on the stance time, and it's on the low end. But then we see the swing time is really short, and I tell people, like, listen, that's why you're walking slower, because you're not taking as long of a step, because your body literally is saying don't do that. And when they don't take care of business, this becomes permanent. And then by the time he reaches 60 years old, if we don't get him back up to appropriate walking speed, he's either going to die 10 years earlier, or those 10 years are not going to be lived with as good a quality of life. So scroll down a little bit further. Right. And now, when we look at the stride duration, we see that again, he's spending a lot more time on one side than the other, and the stride length, and say, listen, to them, they don't know this, but it's your stride length is very very different, and you're approaching 3.5 inch difference. And what does that mean? Well, that actually means that your body's still trying to find this position that it's having the least amount of stress, and in this case, typically it's the least amount of pain. But it's so abnormal that you are abnormally load stressing. And again, like you said, if you continue this pattern, it's actually going to potentially get, worse. Okay. And then if we scroll down to propulsion rate, here's where I really show it's like, listen, you're really pushing off on that one side. And depending on what kind of condition you're in, if we don't take care of this, you're going to end up with plantar flexion, because you're using or you're going to be ending up with plantar fasciitis, because you're not using, your lower extremity appropriately, and you're overstressing, your plantar flexors. And here's what's going to be interesting too, is even if you treat them, because there's a lot of things that we can do that, we can get them out of pain. A lot of these metrics are still going to show up abnormal. And that's my opportunity to show the patient again that, listen, I know you're out of pain, but your performance is not returned. It's like your car, and I don't know why I use a lot of car analogies with patients, but it's like your front tires are wearing completely uneven, and you go out and you buy new tires, and yeah, for a while it looks like everything's normal, but no, you didn't fix the problem. You just bought new tires, and you're going to be replacing tires a whole lot sooner than you really need to be. Or God forbid, you get into an accident because you don't have the appropriate, surface and contact with the ground if you're driving on slick, wet pavement, or if you live where I live, where the snow is. So does this influence, my clinical approach? It does. And it probably has more of an influence on my patients, because um, a lot of times patients come in because of what they think is pain. We need to address that, statistically speaking, because patient satisfaction is really high, but we need to get them to stay longer and get better resolution. So it probably has more to do with my clinical decision-making process after they're out of pain, and allowing me to show the patients that we're here to improve your performance. Reducing pain is easy, in my opinion. You could take a narcotic, and I know people look at me funny. And I said, no, I don't prescribe narcotics, but there's so many options out there. I said, it really comes down to your performance. And I want you to be able to do XYZ for the reason that you came in here to begin with. So it's a great patient opportunity here. It takes a short amount of time, and then it allows me to then actually look at some of these details, because let's say we get Brandon out of pain here, and we still see he's got some really wanky things going on with his feet in that pronation supination, which we already saw. So I like to take care of their pain first, and then I say, okay, man, you've got some serious pronation going on in these feet. that might have been the reason that you experienced that low back pain, because your feet aren't working appropriately and you had some increased stress load on that spine. Let's work on that now too.
Okay.
Was this filtering helpful to you?
Yeah. Yes.
So just so you know, in your system now, you'll need to do this on. So what you'll need to do is, I'm sorry, did you say Jason? Who's your representative?
I'm
Jeff.
sorry. Jeff.
Who's your sales representative that you're using their tablet?
Jeffrey Sheehan.
Oh, Jeff. Yeah, yeah, okay. So what you'll just need to do is ask him to log into the web interface, and he'll help you with the username and password, and you have to create the filter on the web interface.
Okay.
Just so you know, okay. And all you do is create custom filter, name it, and then you can select the data like we showed you.
Okay. Okay. Now you said that there is a clinical guide that'll help us, learn to quickly analyze this data. Is that something I can get a hold of prior to a purchase, just to review?
Yes.
I've got no problem with that. I give a lot of stuff away for free. I know not everyone likes to hear that, but absolutely. I mean, we can show you that, and because we want you to have a good demo. I mean, it's not proprietary information. I think it's really going to help you understand the product and the way to look at it for sure.
That's what I'm
So,
thinking as well.
yeah,
And let me just show
you're right.
you.
It's overwhelming. There's a lot of data at first glance, but like there's nothing here that you haven't heard before. It's aggregating this and kind of making a decision as to, okay, what do I do with it?
Exactly.
And one other resource I want to show you is if you go to digisolepro.com and you click on the resources tab and you go down to documentation, there is not only a user manual and also on the program areas, but a walk analysis and interactive demonstration of the interpretation of walking and running. So you can download these as well. Plus, we'll get you the clinical manual. So this is available on our website as well.
Got it.
Yep.
Good. Okay.
And look, don't be afraid to reach out to Chris or myself. So, and I'll happily put our details in the chat so that if you would like to, communicate directly with us, that is perfectly fine.
Okay. All right.
Let me just put that in there just real quickly. Chris, for some reason my chat function is not working. Would you mind just sticking your email in there for me?
There we go.
All right, now it just came up. I'll put mine, and then we'll also do Chris's. I'll have Chris do his. All right. Do you see those, Robin?
I do. Yep.
Okay, fantastic. Robin, thank you. I appreciate it. Again, we're here for resources and want to help you any way that we can. So please don't hesitate to reach out to us and ask questions.
All right.
Absolutely. Absolutely.
Fantastic. So let's do this now. What I propose is let's go ahead and actually, I'm going to walk through the actual presentation behind this. Give me just a moment. Just got to share a screen, and we will get started. All right. Oh wait, you know what? I'm sorry, wrong one. Let me just get back to the right one. So screen sharing. Share screen. Oh, that's why. That is why. Share screen. Okay. Is everybody able to see my screen?
Yes.
Yes.
Okay, from beginning. Excellent. You might get a little bit of a spinny wheel for the moment. Change. Sorry, folks, give me just a minute. For some reason, I am getting a black screen, which is what we shouldn't be getting. Share screen. Okay, give me 1 second, guys. Sorry, my PowerPoint crashed on me. That's what the issue is. Okay, editing. Desktop. All right, let's try this again. Hopefully, this should get it to where we need it to be. Share screen. Share this, and hopefully, again, you should be able to see my screen.
Yes.
Begin. There's a different current slide. Very interesting. I'm sorry, guys. For some reason, I am having, if you can give me a second, I apologize. I'm having major errors here. I'm going to do this one other way, and I believe this other way will try to do this.
Are you trying to share just that?
I got it now. I was doing, there we go. We should be good now. Do you guys see my screen now?
Yeah.
All right. Apologies, guys. It was crashing in another one. So again, welcome to understanding the Digitsole Pro gait and lower extremity movement analysis system. So happy to talk you through and walk you through with visuals as well as video on exactly what this product does and also how it can benefit the clinic. So we'll go through who is Digitsole, what value it provides you, and then we'll actually take a quick look at the data. So we'll then actually go to the app, show you what's inside of the app, and take it from there. So I'm going to go ahead and screen. So let's just quickly watch a video.
Digitsole Pro equips HCPs with dynamic movement technology and research-grade assessments to save you time and create measurable outcomes. We help engage your patients in a more successful treatment journey. Digitsole adds efficiency and efficacy to your clinical decisions. Our patented DS Pod is the smallest sensor in the world and measures over 30 biomechanical parameters. It's built with real-time dynamic 3D motion capture for precise assessments of patient conditions and helps you provide improved care. Setup is easy. Get up and running in under 10 minutes. Our native app easily syncs with the DS Pods wirelessly to analyze movement data, collecting rich data during fast and complex motion. The multi-axis technology in our DS Pods detects your patient's activity. Proprietary artificial intelligence-powered algorithms translate those motion analytics into your assessment dashboard. You'll see a full report in minutes. Our data efficiently guides the clinical decision and treatment plan for patients with conditions like low back pain, SI joint pain, knee injuries, hip issues, and plantar fasciitis. Our assessments are invaluable in supporting injury prevention and return to work programs. Dynamic 3D Move Scan with the Performance Rehab module, which provides quantified data from jump tests that allows patients to train for injury prevention, proper recovery in pre, mid, and post-season assessments. The running module can capture multi-plane movement data in your office or in the field with the DS Pod, so you get a true 3D assessment of running patterns, unlike anything else on the market. Our app features remote patient monitoring for more flexibility with patient management, safety, and care path optimization. Digitsole helps you define a better treatment journey with quick, easy-to-interpret results and validated patient outcomes to set your practice up for success.
So that gives everybody just a brief scope on, what is Digitsole, who we're about, and a high-level view of the incredible data and activities that you can pull information out and movements with your patient in the clinic. So
Digitsole Pro.
apologies. So what is Digitsole? So just to recap, Digitsole is a patented human motion technology that uses sensors to capture motion. And the way that we like to look at it is if you take the key features of force plate and motion capture and fuse them into one system, that's what you're getting with the Digitsole Pro system, right? It is all based in cloud. So as we'll talk through the hardware here in a moment, as the sensors collect the data, it's transmitted to the app, which then in the cloud kind of unpackages the data. And the beauty of that is you can not only you not only have unbridled access to a tablet environment, but you're also able to use a web app. More importantly, guys, is we're accurate, and we have research to prove it. And so with repeatability, we're able to measure, gait analysis, performance, and function. And the idea is, well, how do we create this baseline assessment tool to enhance treatment plans, identify deficits for not only athletes, but also, maybe those elderly patients that are coming through your clinic. Now, let's talk a little bit about why Digitsole. What is it about it that you're going to want to bring it into your clinic? Number one, it's recovery. That's the reason they're in rehab more than and physical therapy is because they need recovery of their physical ailments. So what we do is bridge the gap between your medical rehabilitation treatment and really your patient's full potential, right? So we give you the data that helps you establish where they are today and where we need to take them for the future and monitor that through the whole life cycle of treatment. It is portable, which is beautiful. So it is very compact, simple, and you can take it anywhere. So you can be in the clinical environment, but if you want to take them into a real world environment, walking down the street, running on a field, whatever it may be, you have that option. And the technology in general is patented and it measures, as I mentioned, the lower extremity biomechanical data with really strong validity, and helps to assess this quantified and qualitative movement data that you're going to see. Now, let's talk real briefly about the web-based and mobile applications. So now we're going to get into the more specific aspects of Digitsole. First of all, our software is an intuitive and extremely easy to use. Once you get in there, you'll see it's not hard to navigate around, but more importantly, we're able to easily access the data and pick certain points inside of our rich 32 parameters that we offer within Walk and Run. Now, the hardware is extremely unique in the fact that we actually offer what is the smallest sensor for its type in production, and that is what we call our DS pod or Digitsole pod. And this pod basically will allow, and what is, if you will, the engine of what collects all the data. Okay, so it's a combination of things like an accelerometer and a gyroscope, and it records steps, stride length, forces being exerted, newtons onto the ground, and many, many other types of data. It is driven also through our proprietary algorithm. And that proprietary algorithm is what kind of unpackages the raw data that's in here to give it to make it a very usable data. Now, the question is what's the vehicle? Where does this go in? And if you pay attention to your screen, you'll notice that there is a set of insoles. So it's roughly 6 sets of insoles. These pods insert into the insoles, and then what you do is put them in a patient's shoe, and then they're off walking or running or jumping, depending on what the activity is. And that's how you're collecting the data. Now, let's take a quick look at, now that we know what the hardware and software and how they work together and what data they're, what are we really using this for? As I mentioned, 32 different parameters, and really recommended for anything from MSK disorders, return to sport, active, fall assessment, which is obviously very, very important now, and even neurological disorders, being able to track the progression or regression of those. So what about the data? 32 walk and run parameters, overall 20 performance parameters, which are based on jumping motions. As I mentioned, it's 3-dimensional. And I think what's really unique about this is the fact that you can take this real world. Okay. So what we're going to do is I'm going to just quickly walk you through the 3 different modules that we have, and then a couple add-ons. We'll go a little bit deeper into jump, and then we'll have a quick look at the interface to see what that looks like. Okay. So first, there's walk module. You can see the general parameters, the foot kinematics, and the advanced parameters that we measure, right? I won't go through every single one of them, but as you can see, very broad, very rich in what we measure. On the run module, run is got some incredible details. It captures things that typically won't even be able to measure with cameras. So it makes the experience inside of run very, very valuable. So again, general parameters, foot kinematics, and advanced parameters. And last but not least, what is considered our performance rehab module. Now, this performance rehab module basically is based on 4 key jumping movements, which is counter movement jump, single jump, lateral, and triple hop, right? And so think about this from a baseline for prevention, return to play, and in other areas as well, that you are going to have a much higher activity that you need to measure. Okay. So let's just take a look real quick. I'm going to go a little deeper into PRM, or we call performance rehab module. And what do these jumps look like? Kind of what some of the data look like, and then we'll actually take a dive, just because we're finding this is a very unique feature inside of the system. So one here is this is considered our counter movement jump, which is basically just a single vertical jump, right? So we're measuring things like symmetry, how high they jump, and a jump profile, along with some other advanced features. And then there's the single hop. Now, the single hop is a single leg for distance hop. Again, same thing. We're looking at symmetry, distance, flight time, other rich details. And not only that we're looking at what time is spent in the air, but also what the quality is like when we meet the ground. Okay. And I think that's what was very thing is, are we stable or are we unstable? Lateral hop. So this one basically looks at what is 30 seconds on each single leg, a lateral hop between a specific distance. And again, really interesting jump count, symmetry, the cadence evolution, the milliseconds spent in the air and on the ground, and also looking at the quality of the land. Okay. And then last but not least, I think this is probably the most famous of these performance tests, which is considered the triple hop. The triple hop then looks at a summary or a symmetry of what are the 3 hops put together. So basically, if you look at this, you'll see 1, 2, 3. And the idea here is the distance between each one of them, the quality of the hop, as well as other factors like height and time spent in the air. And more importantly on this, it's about the symmetry. Okay. Now, last but not least on this, I want to think, and I think a feature that is very underappreciated inside the Digitsole system is with the walk, run, and performance rehab modules, you do have the opportunity to also video. So you can toggle on, and while they're doing the activity, take a video and use the video to actually lay it next to the data to kind of analyze, what am I seeing visually versus what am I seeing objectively through data. So it gives you 2 different scopes. If you haven't had a chance to experience video or you'd like to experience, let us know. This is an absolutely phenomenal feature within inside the system. Okay, so now from here, what I'm going to do is we are going to take a quick tour through the actual software. Okay, so I'm just going to quickly open another page and we will get started. Okay. All right, so we'll share the screen again. Excellent. All right, so let's just take a quick tour through what the interface looks like in the data we get. So this is the web interface. The app has a similar look and feel, obviously just on a tablet or a phone environment. So on the left, we have what is considered home, patients, equipment, settings, and support. So the primary pieces that you'll be using is these first 3, which is this kind of gives you just a quick snapshot of, how many patients do I have? What are my modules looking like? Kind of, if you will, your stuff, so you understand it. Patients, this gives you a scope of, here's all your patients. You can add a new patient here. You can search for specific patients. And then, this looks at the amount of devices, or if you will, our pods, which is these, that are inside of your system and are able to connect to what is the tablet. Now, the data itself is acquired from, as I mentioned, the sensor to the app, which is the Digitsole Pro native app in the tablet setting, be it iOS or Android. Now, once you actually collect the data through the app, this is where it displays in addition to the app is on the web interface. So I'm going to go through the web interface, and let's just look at a couple quick analysis, and I'll use me for an example. So again, I'm going to click on random. We're going to first look at walk. So just so everybody's aware, walk and run are sold together as one bundle. So here's my dashboard. Here's showing basically, and you can add conditions. We can also add reason for consultations, and it shows my latest activities. So as you can see, I've got about 5 different walk activities. Now, I'm going to give you some detail before I go into this specific analysis. At this point in time, I personally had a low back strain I did while doing a squat exercise. So there is an interpretation guide if you have questions that you can download straight from the interface. And you do have things like being able to filter out and creating custom filters, along with looking at different details, and beautifully being able to export the data, compare the data, and also be able to rename the analysis. Instead of just walk, you can name it, Brandon's walk on January 3rd, whatever it may be. All right, so let's just first there's initially a global view, which looks at, this is kind of the core fundamental data that you need to establish. So symmetry, which is looking at a walking profile stance, are we symmetrical? Cadence, which is a steps over minute, and the speed. So if you notice they're in green, we're in a favorable area. If it's in yellow, it's kind of like a stop sign. We're in a questionable area, and red, it's something that needs to be actively addressed. Okay. So first we have the walking profile, and this looks at stance versus swing time, and also the length of the actual profile from the time in 1 foot meets the ground to the time it happens again. Now, here's what it is in advanced to give you an idea. We're able to toggle on the advanced setting, which then digs into the details further, such as stride duration in milliseconds, stride length in inches, again, swing time in milliseconds, and stance time in milliseconds. And then as we move down further, this is the gait line. This is how pressure is moving through the foot. So as you can see, it's quite favorable here. It also gives us the time spent in each category. So are they having a hard time getting through progression of movement through the foot? And then propulsion ratio. So I want to really call this out here. This is specific to me. So again, musculoskeletal low back pain strain predominantly displaying on the right-hand side of the back. Now, what we're able to see here is this is how the plantar flexors or gastrocs work in harmony with or against the hip flexors. So as a protection factor for me specifically, I was having a harder time engaging my hip flexors. So what the algorithm is able to do, bringing in multiple pieces of the analysis, is really analyze where one is working harder than the other. And in this instance, we can see my left side's looking pretty good. My right side, my gastroc is working harder as a compensatory type of motion. So we already know by looking at this, we definitely have some inhibition issues happening at the hip flexors, which might be evidence, but sometimes you don't understand exactly to what degree. This data can help you to understand better to what degree that is. Okay. Now what we're going to do is we're going to go up here and click on details. When I click on details, you're going to see a whole nother set of data that gives you things such as dynamic pronation, supination, so you can see how the foot is functioning. Again, the foot is the foundation of our building of the building of the body, and we're able to see. Should we potentially look at, is pronation a factor in the condition of this patient, or supination? And in my instance, you can see my right foot, which is the affected side, has some excess pronation issues as we get late mid stance into toe off. Excuse me. Foot progression angle looks at AB adduction of the foot and circumduction. So specific instance here, I've got 6.2% abduction on the left, and on the right 16. So as you can see, a pretty significant delta left to right, roughly 10 degrees. So again, this was a compensation for the way I was walking. So we're able to use this as a baseline to objectively assess how well is my patient getting. A 1.4 inches is also my circumduction on right versus left. And then a factor on me that I'm, not as much of an issue for, but think about those patients who might be considered a fall risk, or that you are really concerned about, making sure that they're staying upright as long as possible. And this is what we call steppager clearance. And this looks at not only the angle the foot leaves the ground, but the clearance of the toe over the ground, and what we call the attack angle. So basically the dorsiflexion angle their heel strikes the ground. So are they a shuffler, right? So as we know, a shuffle gait is not ideal. And this data right here helps for you to understand. Now, I want to show you a couple other key tools. Below each of these, you're going to find that there is a just very brief and quick interpretation. You are able to add comments. And we also give you a somewhat of a global interpretation as well. Okay. So that's part of the algorithm and the beauty of that. And I want to just show you one other quick feature, which is called evolution. Now, evolution is able to look at multiple different factors and what is the evolution either in a positive or negative manner around symmetry, cadence, speed. So it takes the multiple analysis you've done and compiles them into one graph or chart. And again, it includes all the parameters that I showed you earlier. Okay. So that's a quick view on walk. Let's now take a quick look at run. All right. So we're going to take a quick look at Tom Allen. All right. So Tom, let's go through here. We'll take a detail on the first one. All right. So we'll see here, total time is roughly 2 minutes spent running. Guys, the time that we can spend running is significant. Again, as I mentioned, real world. So if you want to put a set of insoles, let them go out into the real world and run a 5K or 12K, whatever it may be, by all means, the recording time that is available is roughly 2 hours. So you have a lot of time for them to clutch it. So notice here, speed and cadence. So this looks at obviously miles per hour, and then cadence, which is steps over minute, and also where was the analysis type taken. All right. Now here gives you just a quick graph, and just this is in 10-second increments, as you see at the bottom. And what we give you is the data on 15-second increments, right? So you can look at what is the Kate over speed ratio here. So are we following a linear line? Do they converge or diverge at some point, which is going to measure things like fatigue factors and other things as well. And then we look at things like asymmetry. So this is the amount that is spent more time on the right in contact with than the left. So there's a bit of an asymmetrical run here, that right foot standing on a little bit more time on it. Strike pattern. So are we a heel striker, a midfoot striker, or a forefoot striker? Really great information so that if you need to train runners to do things differently, you're able to. And the amount of newtons that are being exerted down onto the shoe or onto the ground. Then we look at running profile, which is stance time versus swing time. And you can look at the deltas here. So are we symmetrical or are we asymmetrical? And then I'm going to get to pronation supination angles. Guys, in run, this is extremely hard to measure. I'm happy to say that our system, our sensors measure it accurately. And I can scroll over these different dots at different points and actually find exactly how much pronation or supination or angulation that the patient's experienced through a time. And the middle centerpiece is what you're considering our kind of our median, and then there is a mid and a max as well. And there is an absolute and relative. There is no relative, absolute data behind run, so you can also do it relative to the patient. All right. Now, one thing that I do want to highlight that I think is an awesome feature inside of this, if I go over to details, is I'm able to pick 2 points in time. So let's just say at second 15 or second 15, and then we'll go at minute 145. And I'm able to layer that data over each other and look to say, what am I seeing as a difference? So we can see here his symmetry is actually improving. His force is actually not improving. And then we get a lot of other metrics such as stride length, stance time, swing time, angulation, so on and so forth. And then you can write your comments. So the beauty is you can look at things like fatigue. And then you're also able to say, hey, patient, where did you begin to hurt? I hurt at minute 1. Okay, great. Let's look at times when you didn't hurt versus times when you hurt and see biomechanically what those deltas look like. Okay. Same thing we're able to do here is layer over an evolution. And on this one, I'm going to briefly show you also. So this is your evolution failure, excuse me, your evolution. And what I'm also going to do is go back to the dashboard. Sorry, guys, it took a little bit of a wrong turn, but that's okay. And then if I click on this, I'm going to just do a quick export. So inside of this, you can see I'm able to export the data to a PDF, which can be either sent to a referrer, given to a patient, or even uploaded into a medical records system. Okay. I'm able to modify the details I see on this as well. And then on the bottom, you are able to also put comments and actions that are recommended. All right. So that is a little bit on run. Now I'm going to show you one other thing, and that is going to be on what we consider jump or performance rehab. All right. So I'm going to go to a specific patient. Okay. Let's take a look at Jake here. So Jake Jensen. All right, so we're gonna first start with CMJ. So I'm gonna take a quick look at Jake here, and we're gonna see within CMJ. Again, I can enter all the details. This is incredible information, folks, and this is something typically you're using a very antiquated, old school method to gather the data, be it a measuring tape or a piece of tape on the wall. Many other things can be done to measure this, which are somewhat flawed and potentially with a high error aptitude. Now, let's look at this real quickly here. So left versus right, so we're able to establish not only a cumulative, but a left versus right strategy. It's going to give you the millisecond spent, the delta in flight, the delta of that, and how high we are jumping. So as you can see here, it was roughly a 14.2 inch vertical. And then from here, we're also able to look at things like flexion angle at takeoff, the velocity at which they take off, a contact stability, which is key. And one of my favorites is looking at things like max acceleration at landing. So how are they landing? And the pronation, supination angles there as well. Okay, so this is all available under the advanced setting. And again, you do also have the features of being able to export this or compare different times over each other. All right. And let's take a quick look at one of his other ones. So that's CMJ. Okay. So as you can see, just so you know, we are looking at a patient who had an ankle sprain. Now I want to do triple hop with Jake. Okay. So we'll see this in detail. Fantastic. So with triple hop, what we're able to look at is the distance left versus right. So as you can see in the left here, he jumped a total of 187, on the right 196. So he's got good symmetry overall. But let's take a deeper look into this, right? So we can actually look at what is the distance between us. So was he making it up more in one jump than the other? So as you can see here at the start, big distance on the left, but as we get further here, you can see it decreases. Now on the right, it's almost like he's warming up, right? So really good data. Again, average time in stance versus swing on both left and the right. Again, some of the general parameters that I showed you. If I toggle on advance, there's one other key piece that you're getting into these single leg jumps, which is rotation around Z-axis. Fantastic feature that you're not able to typically measure any other way. And again, some of these other ones like max acceleration at landing, flexion, contact stability, and pronation, supination. Okay, so this is a quick look. We'll take a look at one other one, and that is going to be our side hop. Okay, so side hop again is a period of 30 seconds. So this looks at the jump count, left versus right, the symmetry, which is 88%, which is not ideal here. And again, stance time and swing time, the average, the flight time average as well. And the deltas between that always showed in the middle. And then as you can see here, you're actually able to look at each of the jumps on, what's occurring. Okay. So very, very interesting detail as well that you're able to get off of this. All right. And then last but not least, again, our standard general parameters that looks at multiple things like rotation on Z, max acceleration at landing, so on and so forth. And as I mentioned earlier, you can couple this with the video at the same time, so you get a really, really rich experience. Okay. So I wanted to just give everybody a quick tour. The beauty of this product is, it also makes it a very affordable way to introduce technology in a clinic in an easy way. And if you want to know more on how you can potentially demo this on our web interface or to get other pricing, please reach out to your North Coast sales representative or contact, and they would be happy to help. Okay. So with that said, I am going to conclude at this point. So I'm just going to quickly, I know we got a couple in the room here. I'm just going to quickly open it up for questions. So any questions that anybody would like to answer or ask?
I'm not sure if I have any questions, but it certainly is a powerful piece of equipment, isn't it?
It is, Robin. Thank you so much. So with that said, I want to just thank everybody for their time. Really appreciate the time you gave us. We hope you find the tool useful. And please, if you have any questions, let us know.
Great.
Thank you so
Thanks,
much.
everybody.
Thank you, Brandon. Thank you all.
Bye-bye.
All right. Bye.